We also provide the same day dentistry, even if someone needs just one crown. Usually, crowns will take 2 hours to make. So, in traditional dentistry, you have to have a crown prepared and then you have to wait 2 weeks for the lab to make it. In my office, we can make same day crowns. Instead of waiting 2 weeks for your crown to be made, we can make it in the office in 2 hours.
But root planning, periodontal surgery, gum surgery, deep skull cleaning, in the end, it's all going into your gums, cleaning them out, depends on how deep it is, in end, all the same.
I don't know if I understood the question. You're saying, is it the same or is it different than
Well,
regular
well,
cleaning?
for a layman, it's kind of like, how rotten is that apple? It's rotten. So, you cut off very little. Maybe it's not even rotten. You just brush it and wash it, and it's fine. Or you kind of like
Yeah.
cut off a little bit, or you end up cutting a lot all the way down to the seed, and you clean it all out, and then you can eat it. But in the end, you have a rotten apple, and you need to take out what's rotten, and it depends
Yeah.
how much
Yeah. So,
you take out is the disease.
yeah, somebody with severe gum disease would need either periodontal surgery, and we provide that also in my office. We get patients numb and can do a surgery where they're either sedated and they can wake up at the end of it, or we get them completely numb and they don't feel anything. So we also provide gum surgery if it's severe gum disease. If it's even worse than severe gum disease, sometimes people lose their teeth. So we like to get to them either at the moderate phase or severe phase even. That's better than where the gum disease has gone all the way to the end of the root, and then you do have to extract the tooth.
Right. And never mind that during the time when till the teeth fall out, that may take a year, two, five, whatever it takes, they always have an infection in it if they don't do that. And that infection weakens their body, as we already mentioned in other areas. Now, you mentioned something about the sedation. Obviously, you make the person very numb so that this whole surgery thing, it doesn't do anything. Some people are, first of all, even more sensitive, and they really want to be kind of like not there. And then there is also the patient which has a lots of work to do, and you really couldn't do it because you can't open the mouth and etc. If he isn't, so to say, completely unconscious, fully gone, and you can work 1, 2, 3, 5 hours uninterrupted, and the patient works out more or less with uh, many visits done in one visit. That's
Yeah,
a thing. Is that something you provide?
we call it conscious sedation. So patients are able to breathe on their own, but they're sedated, so they don't remember the middle of the appointment, and they don't. They're completely relaxed, and they can wake up at the end of the appointment, and all their dental work's done in one appointment. So we can provide that service. We call it sedation dentistry, and there are different levels, but most people that want to be sedated, yeah, they want to be out of it. They say, "I'd like to be out of it," and there could be a couple of reasons for that. One, somebody's just terrified of the dentist or scared of the dentist, and so we want to provide an environment where they could be relaxed and out of it, or consciously sedated safely, and do all their dental work while they're effectively almost sleeping. Um, and we can provide that in my office. Other times, scheduling wise, patients have a hard time taking off multiple times to come to the dentist, and they want to get all the work done in one visit. And so we'll sedate people for those procedures too, but they want to just get everything done in one visit.
Yeah, that sounds very economical because it's easier to take off a whole day or a good afternoon or something, get things done, and be back rather than having four, five, six visits. Those interruptions, most of us, is what we kind of hate, not like.
Yeah,
And anyway,
yeah,
good. Well, all right. This is
yeah.
great. Great. Now,
We
let
we also provide the same day dentistry, even if someone needs just one crown. Usually crowns will take 2 hours to make, but or usually, sorry, I should step back. So in traditional dentistry, you have to have a crown prepared, and then you have to wait 2 weeks for the lab to make it. In my office, we can make same day crowns. Instead of waiting 2 weeks for your crown to be made, we can make it in the office in 2 hours.
And that's the final crown or just temporary?
Yeah, that's the final crown. Other patients are happy not to have a temporary crown. We can go straight from a cavity or a broken tooth or a really large filling, a silver filling that needs to be replaced. We can go straight from that to the permanent crown in the same day.
And you can achieve any and all shades, slightly more yellow, more white, whatever it may be, and you can make it. You basically you kind of like you cut that crown in your office. Is that what you do?
Yeah, the computer technology allows us to scan their mouth with a digital scanner. So we've gotten rid of the gooey impressions that go in your mouth. And some patients are just happy to do that, where we use a camera to scan all the teeth, send it to the laboratory, and 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 it can be made in our house. We have an in-house laboratory that has all the colors of teeth and makes it out of a porcelain block.
Wonderful, very interesting, very good. Well, all right, this is very good.